Okay, take 900, cut off in the middle of it. Here we go again. Okay, I am palpating her throat. Her trachea is midline. I cannot feel her thyroid. Her lymph nodes are not too big. And again, I would be using 2 hands if I could use 2 hands. There's no tenderness. The shape is normal. Her thyroid is normal. Her trachea was midline, as I stated. Mobility is normal. Her lymph nodes in all of her regions, in her neck, her groin, underneath her armpits, all locations are regular in size. Are any of them tender? Nope. Okay. Her acuity, we had checked that in the beginning when we were checking the cranial nerves. Her visual fields are normal. There's no edema. Conjunctiva and sclera are normal in color. Her eyebrows are even and fabulous, usually colored in. Now they're albino. Extraocular movement. There was no nystagmus. They're normal. The corneal is light reflexive. She has perla. The configuration of her ears is normal. The location is normal. The alignment is symmetrical. There's no nodules. She has normal hearing. I looked in each one of her ears. Her tympanic membrane is intact. She has a small amount of serum. That's because she cleans her ears. Good for you. Her nose is not symmetrical. She suffered a break when she was young, which causes it to deviate to the left. I'm going to occlude one side. Go ahead and breathe. I'm going to occlude the other side. Go ahead and breathe. Do you breathe with ease on each side, or do you struggle with one side?
This side's easier.
Okay. Do you snore?
No.
How do you know?
Just guessing.
Okay. Noting that. She snores. Okay. There's no polyps. Her septum is intact. There's no sinus tenderness. Can you smell odors?
Yep. That peanut butter.
Is there odors in your nostril? When she
No.
was younger, she stuffed car seat pieces up her nose, and there was an odor with that. Okay, her mouth, I'm going to go ahead and have you say, ah. Stick out your tongue. I'm looking in there. Nice and pink. Her mucous membranes are nice and pink. There's no lesions. There's no sores. Her teeth are nice and straight and white. Her gag reflex is present. Her voice is present. Her chest and size is symmetrical. It's normal. It's not misshapen. Thank you. Sorry. Okay, next I'm going to assess her lungs. And in doing so, I'm going to try to do this with one hand. Hopefully I can be successful. I'm just going to set this down for a second, super quick. Okay, so I'm going to check all the fields of your lungs. I'll start with the forefront. Go ahead and deep breath for me. Breathe out. Perfect. Breathe in. Breathe out. I'm going to go ahead and listen to your heart while I'm right here. I'm in between the 5th intercostal space. Perfect. I notice no rubs, regular heart rate and sound. No murmurs. Okay, I'm going to move on to the other fields of your lungs. Breathe in. Breathe out. Breathe in. Breathe out. Sorry, I'm not going to do that part. Breathe in. Breathe out. Breathe in. Breathe out. I like to get down in the lower lobes because most of my patients are elderly. I forgot you're not. Okay, breathe in. Breathe out. Breathe in. Breathe out. There's no adventitious sounds. Nice and clear. Breathe in. Breathe out. They're not diminished. Breathe in. Breathe out. So I would say bilaterally, all lobes. Breathe in. Breathe out. Are clear. There's no... And I'm going to go ahead and do some percussion. I would put my hand down and do that if I could, but I cannot. Okay, for her heart, I did listen to it. There were no murmurs. Bethany, are you experiencing any chest pain? Okay. Do you experience shortness of breath?
No.
Nope. And I'm going to go ahead and check to see if she has any edema. She is free of edema bilaterally. Her cap refill was great. Her blood vessels are great. There's no noted distension of her jugular. All very regular. Okay. I'm also going to check your carotid. Perfect. I'm going to check your radial pulses. 2+. Perfect. Perfect. Can I go ahead and check your pedal pulses? I just need your feet for that. Thank you. Present. Perfect. I'm going to go ahead and note the color of her skin on her leg, that there's no edema. Go ahead and push against my hand. Her strength is perfect and equal, I imagine, on both sides. Let me see your other foot, please. I'm going to look for your pulse. Perfect. 2+. Again, no edema. Color is perfect. No lesions. It's dry. It's intact. Push against me. Perfect. I'm going to have you squeeze each one of my fingers. Bilaterally equal. Perfect. Now I'm going to go ahead and do an abdominal assessment. I'm going to note that it's flat, it's soft. I'm going to go ahead and listen to the sounds. Definitely sounds every 5 to 35 seconds. Bowel sounds are present and active in all 4 quadrants. Okay. I do know that she has occasional heartburn, that she likes to use heartburn medications like Tums.
Tums.
Yep. It's also good to get some calcium. She is not experiencing any nausea or vomiting, correct? Do you have any flatulence? Okay. Are you suffering from any constipation? When was your last bowel movement?
5 hours ago.
Was there any pain with that? Can you describe the consistency of it? Was it easy to pass?
Easy like Sunday morning.
Okay. Any diarrhea?
Nope.
Okay. I was going to say something else there. Any hemorrhoids?
Nope.
How are you urinating?
Frequently well.
What's the color?
Pale. Yellow.
Okay. Any pain with urination? Any foul odor? Okay. Do you suffer from incontinence? Are you able to hold it okay? Okay. Perfect. Is there any tenderness with your abdomen?
Nope.
Okay. There's no distension to note. I'm going to go ahead and palpate it. Perfect. And I'm just moving from left to right. There's no bulging. Is there any pain with that?
Nope.
Perfect. Okay. Her height is 5'8". Or are you 9 now? 5'8". I'm going to go with. Her weight is
165.
Your BMI is, I would calculate it, and it would probably be, oh, I should have brought down the
It's
other phone.
overweight.
No, it's not. She's not overweight. Maybe her BMI says that, but BMI is not always accurate. Okay, her nutritional status is
Good.
it's great. Her appetite is good. Can you recall for me your 24-hour diet?
Breakfast, lunch, and dinner.
What did you have for breakfast?
For breakfast, I had a egg and cheese croissant.
For me?
For lunch, I had apple nachos and cheese and crackers. And then for dinner, I had a sandwich and watermelon.
Okay. Next, I would have you stand, but I know you're having cramps in your legs, so I would note the pain in your legs. Her posture is symmetrical and strong, nice and straight. The alignment, the symmetry, all of that is regular and normal. She's not having any spasms. Both her active and passive range of motions are present, and she has no deficits in those. There's no tenderness or swelling in any other location but her legs. There's mild crepitus when she bends her knees due to jogging injury. Her muscle strength is strong. Her gait is steady. There's no joint stiffness, and she does not require any assistive devices. Her cranial nerves are intact. Again, her gait is steady. Her balance is steady. Her coordination is normal. She's able to rapidly alternate movements. Go ahead and show me your judo chops. Perfect. Are you having any pain?
Mm-mm.
Well,
Mm-hmm.
your legs. Okay. How long ago did that occur?
Right after I ate my sandwich.
Okay. Can you tell me the intensity of that?
Felt like I was a little baby having growing pains.
Okay. And they're located in both of your legs?
Yep, in my joints.
Okay, is there anything that makes it worse?
Nope.
Anything that makes it better?
Hydration and medicine.
Did you take any medicine?
I took some ibuprofen
How long ago did you take ibuprofen?
an hour ago.
Okay. Do you work out every day?
No.
Do you take pain medications every day?
No.
On a scale of 0 to 10, 10 being the worst pain you've ever felt in your life, could you rate your pain for me?
A 4.
Okay. Do you have any thoughts of depression?
No.
Or I guess I should say, are you experiencing depression?
No.
Do you feel any bouts of sadness?
Mm-mm.
Okay. I think that is about it. Thank you for watching my awesome one-handed video that's going to be in 2 videos because it's on 2 different phones. And you should also know that if this was any other patient, it would be far more professional and accurate. Thank you. Have an awesome night.